My name is Tonse Raju. I am a program officer in the Environmental Influences on Child Health Outcomes Office, managing the Idea States Pediatric Clinical Trials Network, or ISPCTN. Thank you for your interest in this new funding opportunity titled Clinical Sites for the Environmental Influences on Child Health Outcomes, Idea States Pediatric Clinical Trials Network, third cycle. The purpose of this webinar is to provide potential applicants with an overview of the ECHO program and an ECHO Idea States Pediatric Clinical Trials Network. I intend to provide an orientation to this funding opportunity announcement and answer some frequently asked questions. In 2016, NIH launched a nationwide program called the ECHO program. The mission of the ECHO program is to enhance the health of children for generations to come. The ECHO program research on child health and development focuses on 5 key pediatric outcome areas that have high public health impact. These areas are pre, peri, and postnatal health, upper and lower airway conditions, obesity, neurodevelopment, and positive health. In 1993, following a congressional mandate, the NIH implemented IDEA programs with a goal to broaden the geographic distribution of NIH funding. These programs support faculty development and institutional research infrastructure enhancement in IDEA states that have historically received low levels of support from NIH. In addition, the programs serve the unique populations in the IDEA states which are predominantly rural or underserved. The 23 states and the Commonwealth of Puerto Rico are named as Institutional Developmental Award eligible states, and they are shown in this slide. I'm going to read the names of these 23 states and Puerto Rico in an alphabetical order. Alaska, Arkansas, Delaware, Hawaii, Idaho, Kansas, Kentucky, Louisiana, Maine, Mississippi, Montana, Nebraska, Nevada, New Hampshire, New Mexico, North Dakota, Oklahoma, Puerto Rico, Rhode Island, South Carolina, South Dakota, Vermont, West Virginia, and Wyoming. In 2016, NIH established the ECHO Idea States Pediatric Clinical Trials Network. The overall goals of the network are to provide children from rural or underserved populations access to state-of-the-art clinical trials, to build pediatric research capacity within the IDEA states to conduct these trials. Additional goals include engaging communities and interested parties in ECHO ISPCTN research processes and enhance diversity, equity, inclusion, and accessibility in workforce and participants. In this slide, I'm showing the NIH ECHO program that has two main components. On your left side is the ECHO Cohort Consortium, and on your right side is the IDEA States Pediatric Clinical Trials Network, or ISPCTN. The ISPCTN is the intervention arm of the ECHO program, and it is the focus of this presentation. In addition, specific goals through the first 2 cycles of ISPCTN are listed on this slide. ISPCTN overall goals from the first cycle, that is from 2016 through 2020, were to allow children from rural or underserved populations access to state-of-the-art clinical trials and to build pediatric research capacity in the ECHO ISPCTN funded IDEA states. In the second cycle, we added engaging communities and interested parties in ISPCTN research processes, and we also required 1 to 2 junior investigators. Additional cross-cutting goals added in Cycle 2 include to enhance diversity, equity, inclusion, and accessibility in workforce and research participation. In the section 1 of the RFA, you will find a high-level description of this funding opportunity. This RFA invites applications from entities and institutions in the idea states to participate as clinical sites in the ECHO ISPCTN. The announcement runs in parallel with the companion RFA OD 24-009, soliciting applications for a data coordinating and operations center or DCOC within the idea states. The clinical sites and the DCOC together will form the ECHO ISPCTN. The clinical sites of the ECHO ISPCTN are required to develop, conduct, and disseminate findings from pediatric multi-center clinical trials, assuring the participation of children living in rural or underserved communities located in the idea states. It's also required to build pediatric clinical trial network capacity in the idea states funded by the ECHO ISPCTN, and to engage interested parties such as community members, non-profit organizations, and professional societies to enhance ECHO ISPCTN clinical trial impact, transferability, rigor, and feasibility. This award will support approximately 5 pediatric clinical trials related to the prevention or treatment of conditions in at least 2 of the 5 outcome areas mentioned earlier, namely pre, peri, and postnatal outcomes, obesity, upper and lower airway conditions, neurodevelopment, and positive health. This actually means that a single topic cannot be the focus of research in more than 3 trials. Therefore, among the 5 clinical trials, at least 2 topics will be represented. NIH intends to fund an estimated 15 to 20 awards corresponding to a total of $7 million for fiscal year 2025. Future year amounts will depend upon the annual appropriations, and the number of awards also is contingent upon the NIH appropriations and the submission of a sufficient number of meritorious applications. Award budget. Applicants may request a direct cost of up to $300,000 for each of the 5 years of the award. The application should include a detailed budget for each of the study years that are being proposed. The award project duration is 5 years. Eligibility information for the institutions that can apply include institutions of higher education, non-profit entities other than the institutions of higher education, for-profit organizations, local governments, and of course the federal government. Only the institutions located in the 23 IDEA states and Puerto Rico are eligible to apply as the lead applicant organizations in response to this RFA. I'm going to read the names of these 23 states and Puerto Rico in an alphabetical order. Alaska, Arkansas, Delaware, Hawaii, Idaho, Kansas, Kentucky, Louisiana, Maine, Mississippi, Montana, Nebraska, Nevada, New Hampshire, New Mexico, North Dakota, Oklahoma, Puerto Rico, Rhode Island, South Carolina, South Dakota, Vermont, West Virginia, and Wyoming. The program director or principal investigator from an idea state should have skills, knowledge, and resources necessary to carry out the proposed research work. The PDPI must be capable of providing both administrative and scientific leadership to the development and implementation of the proposed research programs. At least one PDPI for the clinical side should be a board-certified pediatrician in an IDEA state. PDPIs will supervise the development and conduct of ECHO ISPCTN clinical research at their institution and any participating partner performance site. To enhance the research expertise and potential to build capacity to include needed expertise on multi-center clinical trial proposals, ECHO ISPCTN clinical site and DCOC applicants may propose collaborations. Applicants may consider collaborating with other components or investigators within their own state or in other IDEA or non-IDEA states. For partner institutions from non-IDEA states, total budget per year should be no more than 25% of the total annual cost awarded to the applicant organization. Applicants are encouraged to leverage resources and facilities supported by other NIH programs, such as the IDEA program Infrastructure for Clinical and Translational Research, or IDEA CTR, and the Clinical and Translational Science Award, or CTSA program. A letter of intent is not required. However, such a letter helps NIH staff to estimate review workload and accordingly plan for the review of applications. In the letter of intent, please include the 5 elements listed here, namely descriptive title of the proposed activity, PDPI contact information of the other key personnel, participating institution or institutions, and the number and title of this RFA. Please address the letter of intent to Dr. Lisa Steele, spelled as Lisa, first name, Steele, Steele, last name, PhD, Centers for Scientific Review, MSC 7768, 6701 Rock Ledge Drive, Bethesda, Maryland 20892-7768. Her work phone number 301-257-2638 and her email address lisa.steele@nih.gov. The key dates to remember are letter of intent, that is optional, due date April 1st, 2024. Application due date April 15th, 2024. Scientific merit review October 2024. Advisory council review January 2025. Earliest estimated award date is May 2025, and then earliest estimated start date is June 2025. Some suggestions for all applicants are shown on this slide. Please read both funding opportunity announcements for the third cycle of ISPCTN that have been published. And these are RFA OD-24-008 and RFA OD-24-009. Please read both frequently asked questions or FAQ files, which are available on this website. And these are the Word file for the clinical sites RFA OD-24-008 and the Word file for the Data Coordinating and Operations Center RFA OD-24-009. And please see both webinars available on this website, which are one for the clinical sites RFA and the other one is for the Data Coordinating and Operations Center, RFA. If you have additional questions, please feel free to send me a note. My name is Tonse Raju. I'm going to spell that. My first name, Tonse, and my last name, Raju. And my email address is tonse.raju@nih.gov. Thank you very much for your interest in this funding opportunity announcement.